Hesitant to shed those masks despite the city's latest mask mandate allowing vaccinated New Yorkers to ditch the face coverings.
Most people weren't wearing masks. A couple people were, but for overall, it wasn't a lot different than working out with a mask. I was actually kind of surprised, but it was fine. Everyone seemed comfortable.
People are working this out. New Yorkers done an amazing job, absolutely amazing. We have to take stock of this. People listened to the guidance, they followed it, and a lot of people are going to keep their masks on now because they just want to, be careful. And I think that'll go on for a while.
City's top doctor, Health Commissioner Dave Chokshi, says he's going to keep his mask on for now. And the Health Commissioner joining me now live. Good morning to see you. Good to see you, Dr. Chokshi. Thanks for being here.
Good morning, Dan. Thanks for having me as always.
So day one of New York's mask mandate behind us. For the most part, there are still more questions, though I think a lot of New Yorkers have than answers about when and where we need to keep those masks on. Can you simplify the message for everybody?
Yes, thanks for the opportunity. And let me try to break it down. It really boils down to two main questions. The first is, are you fully vaccinated or are you unvaccinated? If you're fully vaccinated, that means that just about every activity is safer. And if you're unvaccinated, it means you have to continue following the public health precautions. That means masking, distancing, and others that have helped keep us safe.
So if you don't mind, let me just stop you right there. Because I'm sorry, I know. But let me just because that's where I think the confusion comes in, right? Because during the press conference yesterday with the mayor, you actually said, even though you're fully vaccinated, that you are going to keep your mask on while indoors. So people are saying, okay. So they're saying if I'm fully vaccinated, I can take it off, but he's now saying he's going to keep it on.
Right. So that leads to the second question that I was getting to, which is, are you outdoors or are you indoors? If you're outdoors, again, that means that things are quite safe. But if you're indoors, that means we remain at a higher risk. And the question is really when we have a mix of vaccinated and unvaccinated people in indoor settings. That's why, for example, in schools or on the subway or other public transportation, we are continuing to wear our masks. In fact, it remains required in those settings. And in other indoor settings, although it's not required, our recommendation is to continue wearing masks in those settings until more people get vaccinated in New York City.
Okay. And, there's a lot of caveats then for businesses when it comes to those mask requirements, which I think many New Yorkers also find confusing. The mayor said in the soundbite earlier that everybody's trying to work it out. So is the city providing guidance for restaurants and businesses as we move into this next phase of reopening? If a business says, hey, we're going to shed the mask, that's okay.
Yes, I do understand that. And we take the federal guidance from the CDC and others, marry it up with the state guidance, which regulates businesses and other settings. And our job as the city is to ensure that that's translated into practical advice for New Yorkers. And that includes business owners. So for them, what I would say is that, you have a couple of options. The first is if you are able to verify the vaccination status of people who are entering into your business, then that means you can forego a lot of the restrictions that have been used in the past. For example, if you have, all fully vaccinated people in your business, you no longer have to use masks or distancing in that environment. The issue, of course, is that, many businesses won't be able to do that. And in those circumstances, although fully vaccinated people don't necessarily need to use their masks, we're encouraging people to continue doing that.
Right. And I think it comes down then to two questions, right? Because herd immunity is that big thing that everybody throws out, right? The 70 to 80%. So twofold question here. How many New Yorkers are unvaccinated? And can you provide a timeline then of when this city can completely ditch masks?
Yes, well, I'm thinking about this as well. We're at a great point in our vaccination campaign, over 7.7 million doses administered, and 60% of adult New Yorkers have gotten at least one dose. But when it comes to your question, which is, how many people are still not fully vaccinated, it's still a significant number of New Yorkers who are not yet fully vaccinated. This means two things. First, we have to redouble our efforts to get to the people who are not yet vaccinated. We can't mistake that progress for victory. And the next few weeks will be critical, for us to continue those efforts. And then the second point is, while we are building up that community immunity, we should still use the precautions that have worked for us over the last few months.
Doctor,
if we were to think about COVID-19 as, a relay race, it's masks and distancing and those other public health precautions that have allowed us to be in the lead here in the final leg of the race. And it's vaccination that will carry us through the home stretch.
We are out of time, Doctor, but I just want to ask one question I think is number one on people's minds. If you're fully vaccinated, you're in a place with people who are unvaccinated. Do you have a reason to worry?
You are very protected in that circumstance. So I would say your worry level should be quite low. But we always have to think about those who are around us as well. And that's the reason that you may still want to take some precautions in that setting.
Understood. Doctor, you make everything sound so clear and easy. I appreciate you always coming on to help navigate and explain things for our audience.
I appreciate it. Thank you, Dan.
All right.